on psych wards is actually a really unique experience, and here are some interesting things that you may not know. Firstly, every staff member who works on a psych ward is required to carry an alarm with them, which is a sort of pendant alarm which you attach onto yourself and pull in cases of emergencies. And this is if a patient or staff member is at immediate risk of harm. And I think I've only have had to pull mine possibly twice in my career, and only in one instance was there an immediate threat to myself. But what's excellent about these is it will determine your exact location, and all staff members on the unit will be notified and will attend immediately. Secondly, patients who admit to psych wards are either there voluntarily or involuntarily, meaning that they're detained or sectioned under a mental health act. This is done if we feel that the patient lacks capacity, meaning they're so unwell that they don't really understand why they need to be in hospital, or they've refused to come into hospital and we feel that their risk of harm to themselves or others is too high for them to be treated in the community. They definitely do have rights under the Mental Health Act, and if they disagree with that decision, they can appeal it. And this will have to go to a tribunal, which will include a judge, a lawyer representing the patient, and an independent doctor assessing the case. And they would have to assess the case to determine if our decision to keep them in hospital against their will is appropriate. And the third thing is the ward round, which means it includes the consultant psychiatrist, the resident doctors, and the nurses. Actually doesn't occur every day on a psychiatry ward. They typically happen every week, which is completely different to other specialities where it happens every day. And the reason is, in psychiatry, changes in mental state tend to happen quite gradual, as well as response to medication. And we can often effectively assess that over a longer period of time, but they will definitely be seen by the nurses and the doctors during the week. I'm Dr. NaFisa, psychiatrist, and if you found this interesting, follow for more.